Here, today's video is going to be on progesterone supplementation. When should we use progesterone? When shouldn't we? Before we dive in, put your comments down below. Really like to know your experience using progesterone, side effects, benefits, the whole 9 yards. Give me a thumbs up. Really appreciate it. Give me a share on that. Really helps the viewership as well. Appreciate it. All right, so let's dive in. What is progesterone? Progesterone is actually, it's a hormone, predominates more on females. Men definitely have progesterone. Progesterone, lots of good benefits. It's a GABA chloride channel opener, helps with relaxation. We have this natural estrogen progesterone balance. Progesterone on average throughout the month is about 20 to 25 times higher than estrogen throughout the month. Certain times of the month, it can be 300 times during the luteal phase, and on average, 25-ish or so for progesterone to estrogen. So when that ratio starts to drop, even if progesterone is higher than estrogen, we start to call that estrogen dominance, just an FYI. But progesterone really helps cells in the vaginal lining to mature, very important. So we always say estrogen helps cells grow, progesterone helps cells to grow up, so maturation. You can also think of progesterone as sticky glue that really helps the egg implant during a cycle or during fertility, right? So essentially that egg comes out right around day 15 or 16. Again, sperm comes up there, hits that egg, and then it's going to eventually make its way into the uterus, and ideally that good healthy progesterone level supported by HCG typically at that point really helps hold that egg in place. And then of course in that first trimester HCG and progesterone will start to increase as well. That kind of holds that egg and helps it stay in place and helps mature it, right? Progesterone, progestation. So progesterone is very helpful for pregnancy, for fertility, relaxation, for sleep. Progesterone also helps with stress, right? Progesterone can be converted to make stress hormone. So progesterone can go downstream into cortisol. And cortisol is an anti-inflammatory stress hormone. So yes, progesterone can be used to deal with stress intermediately, short term. If you're chronically stressed and you're chronically having to dip into that progesterone to deal with stress, it's like putting your debt on a credit card. That bill will eventually come due. So it will cause problems in the long run if you're chronically doing that, right? That's why we want to have really good adrenal support, a really good adrenal backbone, because the adrenals make cortisol. They provide a lot of support for your sex hormones via DHEA, which can trickle down to some of your sex hormones, including progesterone and your androgens. So we want good, strong adrenals, right? If the adrenals are stronger, we're less likely to have to deal with progesterone, and we're more likely to have good progesterone to estrogen balance. Now, when I test females, maybe run a blood test around day 20, or running a Precision Analytics Dutch Complete panel where we're looking at female hormones, adrenal rhythm, as well as hormones around day 20 or so of the cycle. And that's a good time because that's where progesterone is the highest. And that gives us a pretty good window of how progesterone output is, because we know if progesterone is low there, then that tells us we're going to have a big imbalance, because that's where most of the progesterone that comes throughout the whole cycle happens. So we know if that's low, then we know there's going to be an imbalance throughout the whole cycle. We can kind of just surmise that. So in general, if we see progesterone, let's say under 10, I think it's PG per ml on that, but it's 10 on the blood as well. Under 10 or so, we probably start to have some progesterone problems. 15 to 20 is ideal, but below 10, we're starting to have some problems. And I see a lot of women in their 20s and 30s that are even below 5. They're very, very low on the progesterone. And typically on an estradiol, usually it's around I think it's the low 2s-ish, right in that range. I always like to look, when you look at the Dutch test, there's like a dial on there, okay? And so, for instance, left to right, high, low. So volume knob on a car, right? So for me, right, this is low, this is high. So when I look at the dials, I like the dials to be in sync. So let's say if progesterone is here at around 10, which is mid-range, and estradiol is here maybe around 1.5, that's good harmony, right? Because they're lined up right on the reference range. They're within the same variation of the reference range. It's when I start to see estrogen high, progesterone mid-range, I want there to be in the similar percentile on the range. So if they're in the middle of the range for progesterone and middle of the range for estrogen. If we're lower on the range for progesterone, well, at least I like to see lower on the range for estrogen, because hormonal balance matters. Ideally, we have them both, mid to upper 25%, even better. So I like to look at where progesterone sits on the range in relationship to progesterone and estrogen together. I like to look at the exact amount as well. So range matters and amount matters. Next thing that matters is we want to look at hormone metabolism. If we see 2-methoxy, 2-hydroxyestrogen high, or I should say on the lower side, because we're not metabolizing well, that's a sign that we may not be methylating and detoxifying estrogens well. So you have to look at, well, are you detoxifying well? Yes or no, that's important. And it's nice to look at organic acids. So I like pyroglutamate and sulfate are wonderful organic acids to look for glutathione and our detoxification markers. And the other ones would be the big methylating B vitamins, which would be B6, B12, and folate. That'd be xanthuronate and kinourinate for B6 on an organic acid test, folate or B9, and then B12 is methylmalonic acid. So these are, and folate's also 4-aminoglutamate on an organic acid test. So some of the Dutch tests has some organic acids at the end. We also run a full organic acid panel because we want to get a window into methylation as well as glutathione. That gives me a good window if we're able to detoxify our hormones well. Now, again, I'm talking a lot about other hormones because hormones don't function and dysfunction together. And a lot of times hormones, you can have problems with hormones because of the relationship to other ones. So progesterone and estrogen is a big one. The other one is going to be insulin resistance. So if we have blood sugar abnormalities and we're making a lot of insulin, that can definitely throw off androgens and cause more testosterone in women. In men, it's the opposite. It actually causes more estrogen issues out of the gates. So we talked about adrenal strength. We talked about progesterone levels. We talked about progesterone ratios. Talked about estrogen levels as well. Talked about detoxification. Now, the ways I like to support estrogen, if we're a cycling woman, we're going to be using bioidentical progesterone the last half of the cycle. I typically don't support estrogen with hormones if the woman is cycling. If they're not cycling, we may use a little bit of estriol, which is more cancer preventative, but we're going to use adrenal support, DHEA. We're going to use specific adaptogenic herbs. It could be maca. It could be shepherd's purse. On the progesterone side, we're going to use more chaste tree. It could also be more dong quai as well. On the estrogen side, there's some really good herbs to help modulate upstream signaling from the brain to the ovaries via FSH, and also from the brain to the ovaries for LH and progesterone. So we always want to make sure good upstream signaling. We want to look at adrenal strength. So if we have low or high cortisol, if we see DHEA on the lower side, we really have to work on supporting the adrenals. And of course, if we see low progesterone, if it's just borderline low, I never like to give estrogen, or I should say progesterone, out of the gates. I like to support herbs and upstream. If it's significantly low, less than 10 or even closer to 5, we may give a small amount of progesterone and then taper it up from there depending on how significant the deficiency is. So it really depends. And you got to work on the adrenals. You got to work on the upstream signaling from the FSH and LH from the brain to the ovaries. You got to know that a lot of the female hormone reserves can come from the adrenals. So if we have weak adrenals, that can be a problem. And then, of course, what are hormones made out of? Well, cholesterol, fat building blocks. We need to really be able to break down healthy fats, healthy cholesterol, healthy animal products. So if we see a deficiency in HCl or enzymes or gallbladder or fat digestive issues, and we know we have chronic gut issues, whether it's gut permeability or H. pylori or fungal overgrowth or other parasitic infections or bacterial overgrowth, we have to keep that in mind. Maybe not in the short run, but in the long run, we have to always get to the root cause. Like, I'm okay using an herb or a bioidentical support if it's palliative and will make that person feel better in the short run. But in the long run, we have to make sure we're also getting to the root underlying issue. And my goal with hormone support is we're using the lowest amount possible. We're testing. We're trying to do everything to fix the upstream, and we're trying to support the adrenals so less hormone is needed with things like progesterone, for instance. And then we're working on the upstream signaling from the brain, which makes a big, big difference. So if you're a female listening, you're having hormonal issues and you want to dive in and you want a more natural approach to get to the underlying issue, you don't want to be on hormones forever. You don't want to use hormones like a drug. You want to use them naturally. Click down below. You can schedule with myself and our colleagues. I'd be happy to help you out. Look at your labs, create a comprehensive plan, and also make sure you're getting to the root underlying issue and not just covering up your symptoms, whether it's breast tenderness, cramping, mood issues, infertility, skin issues, PMS, back pain, right? Bloating, breast tenderness, all these issues can be a problem. Now, when you use progesterone for the first time, sometimes it can sensitize estrogen receptor sites. So my female patients were always using it very low and slow to dial it in. So feel free to click down below if you want to reach out to myself. We'll dive into some questions here now if you guys are ready. All right, let me see what is cooking in the Q&A world. All right, very informative podcast. Thank you very much. Appreciate it. Matt W. writes in, I actually used a bit of my wife's topical progesterone on a muscle pull, sometimes lower back from a muscle tweak. I've done this because I've heard that it can help with muscle recovery. Yeah, progesterone is very anti-inflammatory, okay? Now, as a man, progesterone can be used small amounts at nighttime, very helpful for relaxation, can be very helpful for muscle relaxation. Also, for acute head trauma, right? Very anti-inflammatory on the brain. There's some studies using progesterone post traumatic head injury, right? TBI stuff, and shows really, really good recovery. So that's very beneficial. Once a woman is past menopause, what should her progesterone levels be at that point? Typically, I would say like the bottom 20 to 25% of a cycling hormone range. It just depends. So I always start with the lowest possible dose. I'm supporting the adrenals. So if the adrenals are stronger, you need less progesterone. And then a lot of times I'm supporting upstream HPA axis support. So usually you need less. So it just depends upon if other support systems are being put in place. It's a great question. And I don't like my females to start spotting again. So it's somewhere between their symptoms feeling great, meaning hot flashes, mood issues, vaginal dryness, and them spotting. It's somewhere in between that. And so usually about maybe that bottom 25% of the reference range. My goal is to keep females on the lowest possible hormonal dose they need, while at the same time keeping their symptoms clean. Mother Nature's cruel. Like Mother Nature looks at like females in a very harsh way. It's like, okay, your job is to produce a baby and that's it, right? But that's not cool because we want to have a healthy sex life. We want good hair, skin, nails, feel good, sleep good. So we can use some of these bioidenticals to kind of get back some of that youth and keep energy and mood and libido and skin and hair at the most optimal level. So it's somewhere in between, at a spotting to where those low symptoms are. And everyone's a little bit different. And I try to use the lowest possible dose possible. And when you fix the adrenals, that makes a major, major difference there as well. Good question. Do you need to start progesterone supplementation after ovulation? Yes. So ovulation usually is usually about 2 days long. So I try to go into progesterone at least a day into ovulation, because during ovulation, great question, you have this spike of progesterone. I want that natural spike to happen. I don't want to come in there and use progesterone and maybe blunt that spike. So I really want that spike to kind of happen and then kind of ride the wave with progesterone support. So that is very good. And if you're on the fence, you can always you can look at your cervical mucus. Usually some kind of egg white mucus will appear. If you're testing your body temperatures, you'll see a 0.3 degree Fahrenheit drop or more, usually when ovulation starts, and then a rise as you move into it. Okay, so usually around day 15 or so is a pretty good place to start, because usually ovulation starts around between 12 and 14, 13, 14. That way you don't kind of come in there and blunt it. And if you're on the fence, you can always get some OPK strip test and pee on those and test when you're ovulating first. And then you have that 24 to 48 hour buffer. Good question. Okay, notice when I fast in the morning, my throat gets really irritated and I get a lump sensation. Could that be a thyroid issue? It's hard to say. Could be a food allergy issue. But if you're fasting, maybe some biofilm stuff in your throat. Hard to say. Is it normal to feel significantly more stress, rumination during the day after less than 8 hours sleep? Yeah, I mean, you're going to have less neurotransmitter recovery, less recovery. So test it. Get a little bit more sleep, encounter your day, get a little bit less. I think you're going to feel much better during days where you have better sleep before. Also, utilize more amino acids and adaptogens on days where you get less sleep. You may find that's a good way to get through the day, if you will. Are there general labs you like to see your female clients come in with to start? Definitely a really good adrenal test and definitely a really good hormone panel. Most women have some underlying hormonal symptoms, whether it's mood or energy or cognitive or depression, anxiety kind of fit under mood, or PMS. Usually there's some connection there. It's very rare. If there's none, usually an adrenal is good enough, but almost always there's some kind of hormonal issue. The women that come in that don't really have any hormone issues, it's usually they're coming in because they just have a lot of digestive issues. Now, chronic digestive issues can eventually cause hormone issues because of stress and inflammation. Can taking progesterone suppress benefits of estrogen? It depends. Most women are estrogen dominant. So when you're cycling, it tends to not be that big of a deal, but we're supporting the adrenals. So we're going to have a little bit of DHEA support in the background, which will eventually trickle down to estrogen. And then we'll be using some herbs to modulate the hormones as well. So I try to always make sure I'm kind of covering my bases when these issues are happening. Really good question. But yeah, I mean, if you go over the top and you don't support anything upstream besides progesterone, potentially. How do you work with fistulas and Crohn's disease? Well, just fistulas and fissures are basically like abnormal like connections in the intestinal tract, and it's always because of inflammation, right? So you got to follow my 6 R's, right? Get the foods under control, calm the inflammation, fix the hormones, get rid of the infections, make sure you're digesting your food well. You probably need a more restrictive diet in the beginning to really calm everything down, and then address all the gut stuff too. What hormones makes you lose hair? So I mean, it's multifactorial, right? Any woman who's pregnant or who's been pregnant, high levels of HCG cause massive hair growth. That's kind of a benefit of being pregnant, right? That nice pregnancy glow. So when you have your baby and you're no longer pregnant and your HCG levels drop, you will lose a lot of hair. That is normal. So female hormones can influence hair for sure, right? HCG, progesterone, because HCG has a major effect on progesterone. Thyroid plays a major role on hair follicles, okay? Also healthy fats and collagen and protein digestion, because we have to make the hair follicles from something. So we need to have really good protein and fat consumption. So a good diet as well as good digestion. And of course, lots of cortisol can cause tissue breakdown. That can include skin and hair. So obviously lots of stress, lots of cortisol can cause problems there. And then I would say with men, a little bit different, but high levels of DHT can definitely affect men. So, making sure you have good 5-alpha reductase activity. That's the enzyme that converts testosterone to DHT. So with men, really making sure thyroid's good, and then making sure we have really good selenium and zinc levels. And then the other thing I would say is just making sure we can break everything down. Chronic gut issues, chronic gut infections can definitely be a concern. Is there a good marker for showing pre-menopause? So like pre-menopause and perimenopause, it's tough, right? It's kind of like etherical. So you have once you get into your low 40s, early 40s, you could start to have some hot flashes, some mood issues, some back pain, some mood stuff. Now the question, I see a lot of women who are cycling, but have a lot of PMS symptoms that overlap with perimenopause, right? So usually with perimenopause, you're starting to miss more cycles, more periods. You're starting to have more hot flashes, more female hormone issues. So usually with PMS to perimenopause, I think the big variation is probably going to be more skipping cycles and probably more on the hot flashes, where PMS, cycling issues, is just more concentrated just to right before you have your period to a couple of days during your period, if that makes sense. So they're very, very similar. Now, what's the big marker on that? I would say probably skipping your cycles. You may start to see things like elevations of FSH and LH on a lab test too. I know taking iodine is controversial. Can I get enough through certain foods? It depends on your foods. I mean, if you go to myfooddata.com and click on iodine, you'll see some of the really good iodine foods. So you'll see egg yolks are actually pretty good. There's a lot of iodine in some meats too. And then of course your best source is going to be seaweed. Just be careful. Make sure antibodies are stable. If you're going to do iodine, start at a couple hundred micrograms, like 150 to 200, and then gently taper up slowly. I've seen too many people lose hair and not do well with really high levels of iodine. I've seen some do well, but it's so high above, and we know what the data says on iodine when there's active autoimmune issues, it can make it worse. So we got to be careful. Of course, there's the other side where you could have a total deficiency, but if you're eating really good nutrient whole foods and you're getting a couple hundred micrograms in a multi, you're probably going to be okay. I've done the math. If you're eating a really good paleo diet with a lot of good whole foods and eggs, you're probably going to get around 750 micrograms a day. And then with a supplement, you'll probably be around 1 milligram a day, which is pretty good. It's still about 5 times above the RDA. And then worst case, we can always use a small amount of iodine and kind of supplement up gradually, right? There are two schools of thought. Like you have Dr. Karazian, who's like none. And then you have Dr. Brownstein, who's like, do it all, right? Come in at 20 milligrams off the bat. So I'm somewhere in between, but I always err on the side of going low, because it's like once you squeeze the toothpaste out of the tube, it's hard putting it back, right? What causes high levels of prolactin? How do you reduce it? Can it cause erectile dysfunction? Yeah, it can. I mean, basically, low levels of dopamine can cause elevations in prolactin. So here, prolactin's like this, right? Dopamine's the brake. So when you pull your foot off the brake because your dopamine's going low, prolactin can go up. And that can start to dysregulate female cycle. And so usually there's a level of adrenal stress. And again, dopamine, so your adrenals have an inside and an outside, right? The outside's the cortex. That's where cortisol is made and aldosterone. And then the inner part is going to be where your adrenaline comes from, right? And adrenaline is just one step downstream from dopamine. So it goes dopamine, adrenaline. So if you're chronically stimulating the inside part, the medulla of your adrenals, that can deplete dopamine. And of course, dopamine is the brake pedal, right, on prolactin. So you pull your foot off the brake, prolactin goes up, and that can cause dysregulation there. So you got to look at adrenals, neurotransmitters, and it can definitely have an effect there. I have high thyroglobulin antibodies, but normal thyroid levels. Should I be concerned? Well, that's good. Your thyroid levels are normal. Now, again, what's normal? So ideally, at least middle of the reference range, below 2 for TSH, T4 free between 1 and 1.5, T3 free between 3 and 4, or early 4s. That's good, but you need to really get on an autoimmune diet and make sure you're supporting all the anti-inflammatory nutrients, selenium, zinc, magnesium, CoQ10, all very helpful. Autoimmune diet, really good clean multi, extra fish oil, maybe throw in some curcumin and glutathione can be very helpful to calm down the immune system. I take glutathione and curcumin every day because I have an autoimmune issue just to keep it at bay. I'm in your position. I have antibodies that are high, but I keep my thyroid in check, but I do a lot to keep my immune system from going off kilter. When you stop progesterone supplementation and your period doesn't come for a week, does it mean you didn't start at the correct time? It depends. So if your cycle was dysregulated to begin with and you're trying to use progesterone to kind of get that cycle back on track, the goal is you're taking progesterone for about a 2-week period from the middle to the end of your cycle, and then you're stopping. And that drop in progesterone helps signal bleeding, and that bleeding helps get the next cycle going again. It's sloughing off that old endometrial lining, and it's starting the next cycle all over again. And so it's possible if your cycle was already dysregulated, it could take a couple of months to really carve that out. Again, if you had other stressful things going on, I see it a lot with any gut clearing program. That can definitely cause some stress with the hormones as well. If you got sick that month, if you're going on less sleep, there's a lot of other variables you have to look at. What specific herb to break down biofilms in the gut? I love ginger and silver. I treated leaky gut, SIBO, hypothyroid, adrenal fatigue. I've done all these diets, elimination, paleo, low FODMAP with supplements, but I don't seem to get results. Yeah, I would need to have a consult with you to dive in to see what you've actually done. Because just saying you've done something doesn't mean you've done it, right? Meaning maybe you think you did it or you did it to someone else's standards. So I would say click down below. You can schedule with myself. Any idea what would cause the dodging the bullet matrix sensation when walking? It's like my brain's a few seconds slower than my body. Not sure what that means. I'm not sure what you mean by that. Dodging the bullet matrix sensation. Not sure. Oh, you mean the movie when you're like moving in slow motion with Keanu Reeves? Not sure, but I would, look at blood sugar stuff, make sure you're not driving any inflammation that could be making your brain a little bit wonky, right? Inflammation in the brain can cause that level of fogginess and slowness. So I would look at gut, and you can always do just gentle anti-inflammatory support like curcumin or resveratrol, but try to think back to what new things you introduced. All right, guys, this is Dr. J here. Hope you enjoyed it. Enjoyed the information. Put your comments down below. Really love to know your experience in using progesterone. Again, cycling women, only half the month. Menopausal women, the whole month is possible. Now, be very careful if you're cycling. Do not like creams. Creams tend to stay in your system. And when you're like at day 27 or 28 and you're pulling progesterone out, guess what? If it's cream, a lot of times they can stay in your system. The only exception may be intravaginal cream, but most are using cream that's topical on the skin, and that can stay in the system. If you're menopausal, cream may be okay. Vaginal is better, but I've seen it super saturate. So I always lean on drops in liquid form because it doesn't super saturate your tissues. You can get it in your sublingual tissue here, and it goes right into your bloodstream, kind of like an injection without the needle. So be very careful on the mechanism. And progesterone, bioidentical is obviously the best versus like a progestin, right? That makes a big difference. So bioidentical, get to the root cause. Stay away from creams if you're cycling. Maybe the only exception is intravaginal. And if you're taking progesterone for miscarriage prevention, those are the only other exceptions I'd say out of the gates. All right, guys, it's Dr. J here. Hope you enjoyed today's video. Take care, y'all. Bye now. Take care, Facebook.